the unseen impact of COVID-19's enduring legacy. The COVID-19 pandemic has left an undeniable mark on the world. While the acute phase of the illness is often the primary focus, the long-term consequences are increasingly coming to light. Emerging research suggests that even those who did not require hospitalization may experience persistent cognitive difficulties long after the virus has cleared their system. These cognitive impairments can manifest in various ways, affecting memory, attention, executive function, and overall mental clarity. The implications of these findings are significant, highlighting the potential for long-term disability and reduced quality of life for a substantial portion of the population. Understanding the full spectrum of COVID-19's impact is crucial for developing effective strategies for prevention, treatment, and long-term care. By shedding light on this important issue, we can raise awareness, promote early detection and intervention, and ultimately improve the lives of those affected by this global health challenge. When mild COVID-19 lingers, mild COVID-19 can be misleading. Many experience persistent health issues long after the initial infection. Known as long COVID, symptoms include fatigue, shortness of breath, and cognitive difficulties. This underscores the complex nature of COVID-19. It challenges the notion that the virus simply runs its course. Long COVID has significant public health implications. Understanding long-term consequences is crucial for managing this health crisis. The foggy reality, cognitive impairments after COVID-19. One of the most concerning aspects of long COVID is the impact on cognitive function. Many individuals report experiencing a range of cognitive impairments, often described as brain fog, following even mild cases of COVID-19. This brain fog can manifest in various ways, affecting memory, attention, executive function, and overall mental clarity. These cognitive impairments can have a significant impact on daily life, affecting work performance, relationships, and overall quality of life. The uncertainty and unpredictability of these cognitive symptoms can be particularly distressing, adding to the overall burden of long COVID. Understanding the nature and extent of cognitive impairments after COVID-19 is crucial for developing effective interventions and support systems. Further research is needed to determine the long-term trajectory of these cognitive symptoms, identify risk factors, and develop targeted treatments. Real stories, lasting struggles, patients speak out. The impact of cognitive impairments after COVID-19 is best understood through the experiences of those directly affected. Countless individuals have shared their stories of struggling with brain fog, memory problems, and other cognitive difficulties long after recovering from the initial infection. These first-hand accounts provide valuable insights into the lived reality of long COVID and highlight the urgent need for greater awareness, support, and research. One patient, a former marathon runner, described her experience with brain fog as being trapped in a mental maze. She struggled to remember simple tasks, follow conversations, and experienced overwhelming fatigue that made it impossible to engage in her previously active lifestyle. These stories are not isolated incidents, but rather reflect a growing trend among individuals recovering from COVID-19. By sharing their stories, individuals affected by cognitive impairments after COVID-19 are raising awareness of this often invisible aspect of the pandemic's impact. Section 5. Unraveling the mechanisms of inflammation and its role. Inflammation is the body's natural response to injury or infection. When it persists, it can affect various organs, including the brain. During acute COVID-19, the immune system's response can lead to widespread inflammation. This necessary inflammation can also damage healthy tissues, including the brain. Persistent inflammation may contribute to long COVID symptoms, including cognitive impairments. Section 6. Stress in the brain, a vicious cycle. Inflammation and psychological stress both contribute to cognitive impairments after COVID-19. The stress of severe illness or hospitalization can exacerbate brain inflammation. This creates a vicious cycle, worsening cognitive issues. Managing stress is crucial for addressing these impairments. Techniques like mindfulness, meditation, and yoga can help. Section 7. Early detection, early intervention, a proactive approach. Given the potential for long-term cognitive impairments after COVID-19, Early detection and intervention are crucial for mitigating the impact of these symptoms and improving long-term outcomes. Healthcare providers should be vigilant in screening for cognitive difficulties in individuals recovering from COVID-19, even those who experience mild initial illness. This screening can involve simple cognitive assessments, such as memory tests or questionnaires about attention and concentration difficulties. Early identification of cognitive impairments allows for timely referral to specialists, such as neurologists or neuropsychologists, for further evaluation and management. Early intervention is key to addressing cognitive impairments and preventing further decline. Interventions may include cognitive rehabilitation therapy, medication management, lifestyle modifications, and mental health support. By taking a proactive approach to identifying and addressing cognitive impairments after COVID-19, healthcare providers can play a vital role in supporting patients' recovery and improving their long-term health outcomes. Section 8. Cognitive rehabilitation. Retraining the brain. Cognitive rehabilitation therapy is a specialized form of therapy designed to help individuals improve their cognitive skills after brain injury or illness. It involves a structured program of exercises and activities tailored to address specific cognitive deficits such as memory, attention, problem-solving, and executive function. For individuals experiencing cognitive impairments after COVID-19, cognitive rehabilitation can be an effective tool for retraining the brain and regaining lost function. Cognitive rehabilitation exercises can take many forms, including memory games, attention drills, problem-solving tasks, and organizational strategies. The goal of cognitive rehabilitation is to help individuals regain their independence, improve their quality of life, and return to their daily activities with greater ease and confidence. Section 9. Lifestyle as medicine, nourishing the mind and body. While specialized therapies like cognitive rehabilitation play a crucial role in addressing cognitive impairments after COVID-19, lifestyle modifications can also make a significant difference in supporting brain health and overall well-being. By adopting brain-healthy habits, individuals can optimize their cognitive function, enhance their recovery, and improve their long-term health outcomes. One of the most important lifestyle factors for brain health is regular physical activity. Exercise has been shown to improve blood flow to the brain, stimulate the growth of new brain cells, and enhance cognitive function. Another important aspect of a brain-healthy lifestyle is a nutritious diet rich in fruits, vegetables, whole grains, and lean protein. These foods provide essential nutrients that support brain function, reduce inflammation, and protect against cognitive decline. Getting enough sleep is essential for cognitive function, as sleep allows the brain to consolidate memories, clear out toxins, and repair itself. Section 10. The Call for Action Comprehensive. Post-COVID care. The growing recognition of long COVID and its potential for long-term cognitive impairments underscores the urgent need for comprehensive post-COVID care. Addressing the multifaceted challenges of long COVID requires a coordinated effort from healthcare providers, researchers, policymakers, and the community at large. One crucial step is to increase awareness and education about long COVID among healthcare providers. Many healthcare professionals are still unfamiliar with the wide range of long COVID symptoms, including cognitive impairments, and may not be adequately equipped to diagnose and manage these conditions. Expanding access to specialized care is another critical need. Increasing the availability of specialized care through telehealth platforms, community health centers, and other innovative models of care can help bridge this gap and ensure that individuals with long COVID receive the care they need. Section 11. A Future of Hope, Research, Resilience, and Recovery. While the long-term cognitive impacts of COVID-19 are still being uncovered, there is reason for hope. Ongoing research is shedding light on the mechanisms underlying these impairments, identifying potential treatments, and developing strategies for prevention and early intervention. Scientists are working tirelessly to understand how COVID-19 affects the brain, exploring the role of inflammation, immune dysregulation, and other factors. This research is crucial for developing targeted therapies that can address the root causes of cognitive impairments and improve long-term outcomes for individuals with long COVID. By fostering a collaborative effort among researchers, healthcare providers, policymakers, and the community, we can provide the necessary support, resources, and hope for individuals affected by this complex and evolving condition.